Fellow ladies, have you heard of pap smear? Do you know what pap smear is? Have you done pap smear before? And you know the expectations before you go in to have your pap smear? Anyway, today is all about the women. Today is about women's health. My name is Priscilla. Let me send this disclaimer out there. I am not an OBGYN, I'm not a gynecologist. I'm just a nurse who is sharing her personal experience during my pap smears that I've had previously. So let's get right into this video. Thank you for subscribing and sharing all my videos. I'm really grateful. We're getting there, and it's almost a year. I can't believe it. Thanks to you, and thanks for watching, thanks for sharing. It's a beautiful day, so I'm sitting outside. It's very airy, so pardon me if you hear the wind in the video, but the message is going to be clear. So pap smear, I've had a chance of doing pap smear I think twice, and I did a colposcopy one time. I'm going to break this things down to you as simple as I can. So pap smear is just a test you do as a female to see the health of your cervix and test for HPV that causes cervical cancer. You all know early detection is better than waiting for things to go too late and too worse, whereby you cannot get treatment as needed. So it's good to do your pap smear when you are 21 years, between 21 to 65. Pap smear is a test you do when you go to your doctor's office just to check your cervical health, as I said early on. You go to the appointment, you lay on a stretcher, with you scooch all the way to the edge of the stretcher with your feet up as if you in a given bed position. Your feet are up on stirrups. Then they insert a speculum, as you can see the diagram here. This is how a speculum looks like. Insert a speculum into your cervix. The cervix is the tip of the womb, the uterus. Yes. So they insert it through your vagina into the cervix. Then they look at the cervix. Sometimes they do take samples, depending on what they are looking for. The test can be sometimes uncomfortable, but before you go for the test, there are things that you should know. Before you go for your appointment, you might want to just go online. Thanks to YouTube and all this Google stuff, you can go online and read about it and know what to expect, so that you prepare yourself well. First of all, it's not ideal to do it when you're having your menstruation, because there's going to be blood there and it's going to be nasty and the smell is offensive and all that. So you don't want to have your appointment around the time whereby you are bleeding. Nope, you don't want to do that at all. Also, you have to get like your pad or tampon, because some people do bleed at the end of the procedure. It's very rare, but some people do have a little bit of blood, so you might want to put that pad in after the procedure is done. Also, you might want to avoid having sex a day or few days before, because you know the sperm or the semen is still going to be in there and they're going to see that. If you don't mind, it's not a big deal, but it's ideal if you just keep that place clean. You also want to take a shower before you go. Keep that place clean, because legs are going to be open wide. Their nose is going to be down there, because they need to put a speculum there and screw and open until they are able to see what they are looking for. So their nose, eyes and everything is down there. So you don't want anybody to stick their nose in a very nasty, smelly place. So you want to keep that place clean. Take a shower right before you set up for a procedure. Keep clean underwear. Some people have sprays that they have for the underwear or whatever. Just make sure that place is good, clean and smelling good. No blood, no old semen or sperm hanging in there. Just keep the area fresh. If you want to shave, you can go ahead and shave and keep the place very hygienic and very good looking before you go, because you don't want to get embarrassed whilst they are doing that for you. So those are the things you need to know. And have your pad with you, your tampon with you. After the procedure, you put a clean one on. Some doctors' offices have some, they give you extra pad you can put in your underwear after the procedure, but some people are allergic to all that stuff, so you might want to just carry the ones your body is used to for the procedure. It's very airy outside and I love it. So pap smear, they go in there, they take a swab, maybe something like a Q-tip or a cotton wool, sweep the cervical wall and take a sample and send it to the lab. The result takes about 7 to 14 days, maximum 2 weeks. Then they tell you how the results are. If everything is fine, you don't need to do another pap smear until the next 3 years. So they will call you and schedule the appointment with you when the time is getting closer. But if they do find something abnormal, then you have to go forward and do another test called colposcopy. When I did my first test, a lot of things were revealed. I realized I had a tilted cervix. So then going forward from the next ones, I could tell them and guide them that, okay, when you're going in, my cervix is tilted down and towards the left. So it helps the next person who is going to do it. Yes, they might end up finding other things that they will also tell you about. So as a female, you want to get this pap smear done to know your health status, to know whether you have HPV, and to know whether you are on the way going to having cervical cancer or not. Some people have cervical cancer running through their families, so it's good to do this as early as possible. Ideally, so far as you are sexually active, you can start having your pap smear done. But the book says do 21 years and above. So if you do 21 and everything is fine, the next 3 years you're going to do it. That'll be like your 24th birthday or something. And up to 65 is the limit. But even for 65 years and above, if there need be or there's something they want to look out for, they can still make you do a pap smear. But so far as you're sexually active, you're a female, you have a cervix, a vagina, a uterus, a womb, it's ideal to get this test done every 3 years if everything is fine. So in the first time I did the pap smear, I had to go further and do a colposcopy because they were not sure whether the cells had a low grade or high grade, so they wanted to confirm. So I went to do another test, colposcopy. That is also the same procedure. You lay down at the edge, your legs are high up on the stirrup, they put a speculum in, they put a camera in, and they look and see the cells and everything they are looking out for. It is good to take very good care of yourself, especially down there as a female. Keep good vaginal hygiene, wash your underwears, cotton underwears, iron them or dry them in the sun, or use panty liner. Not just insert any type of thing into your vagina, because some of these things carry infection as we insert them. If you're using sex toys and whatever, make sure you keep them very clean. If you're touching yourself, your nails should be short. We all have things that we do to ourselves. It's personal choices. Just make sure whatever you're doing, you do it very hygienically. Men carry HPV around and give to we females, but they go about not showing any signs. Yes, and you don't want to stress yourself out by going to find out who gave you HPV and how you got HPV from. The most important thing is that you've gone for the test and you know what the problem is and you are seeking treatment. Yes, sometimes it can be very scary and uncomfortable, but when you're in the doctor's office, make sure you ask questions. Let them explain to you what they are doing, what they are looking for, how long the results will take, and the implications of the results. As I said, I'm not an OBGYN, I'm not a gynecologist, I'm just a nurse who happened to do pap smear more than once, and these are the advantages of doing pap smear. So go get yourself checked. Some places you have to pay cash for it depending on which country you find yourself. Some places your insurance takes care of it, but it is worth investing into. You want to make sure that you do not have cervical cancer now, than rather wait and think about the cost and later pay for it dearly in the coming years. If you are sexually active, you are a female, you have a cervix, you have a vagina, you have a uterus, that's a womb, make sure you get your pap smear done, because I've done it. Before you go to the doctor's office, read about it, watch videos, know the expectations. The speculums are different sizes. Most of them are single-use plastics. As you can see, they use them and dispose them. They don't use them from anybody. Make sure they open them right in front of you. It will be in a pack. They take it off in front of you to make sure it's brand new. They use it and they discard it. Some of them are metallic, but most of these offices are trying to get rid of the metallic ones. to reduce the risk of infection. It's not hygienic to insert that into somebody else and come and insert it into you anymore. So disposable speculum is what we use. There are different sizes, so based on when they go in and take a look and see maybe your cervix is small or might need a longer one or wider one, then they adjust and change over and put new ones. It's kind of uncomfortable. You have a discomfort at your lower abdomen as they insert, and they screw to open the mouth. So it's like a beak of a bird, and it has a screw. So as they're going in, they are loosening it and opening it until they can open no more, and until they can see clearly, go in there and take whatever they need. That's uncomfortable. I didn't bleed, but I have to put a pad on. You have little discharges. That one, it's normal, it's expected. But if you do bleed, let them know the extent of the bleeding, the color, and ask all questions before you leave the place. Yes, so women health is very important. Pay attention to your body, eat healthy fruits. There are a lot of this cranberry and all that are good. They help with UTI, urinary tract infections. And I'll see you again in my next video. The name remains Priscilla. These are just my personal experiences I've shared. I'm not an expert in this field. I just did my pap smear not too long ago, and I think I should share this with you. Thank you. Share this video with other ladies, your younger sisters, your friends, your roommates, your neighbors, and I'll see you again. Bye bye.